do a few introductions to myself and to my colleague who's going to be presenting with me this morning. So my name is, I'm Staff Wellbeing Manager at Wrightington, Wigan and Leigh. My background is NHS for the last 20 so all of my working career has been within the NHS in acute hospitals, in mental health trusts, and around leadership and management development, organisational development, and more recently staff wellbeing, talking to you today. So I'm also joined today by Dr. Alison. So do you want to just say a few words, Alison?
Thank you. You're breaking up a lot, Zoe. Sorry. That was a bit disjointed. Yeah, we'll see how we get on. So I'm Alison Booth. Hope everyone can hear me okay. I'm the clinical psychologist in the staff wellbeing service in Wrightington, Wigan and Leigh NHS Trust. So I've been with the trust since November, part of a kind of new service there, which we're going to talk to you about today. So as Zoe said, we sort of sit within corporate, within staff engagement and organisational development within the trust, and we work within staff wellbeing services that we've sort of developed over the last 12 months, really, building on what Zoe was already working on prior to the pandemic. So nice to meet everybody. Thank you for inviting us. I think Zoe's going to share screen if this works.
Okay, it's just taking a little bit of time to come onto the screen.
So we're going to be talking you through some content around our service and just where we've got to really over the last 12 months, sort of the context of how we set things up from the service, where we've got to now, and hopefully a little bit the challenges on the way. We've only got a few slides to share, and then we'd hope to sort of have a discussion. So if you've got any questions or any thoughts along the way while we're going through the presentation, perhaps just put your comments in the chat, and then we'll just come to all of them at the end, and we'll hopefully have the last half an hour for sort of discussion and feedback and things like that, if that's okay. So we'll share with you some of the kind of things we've been working on first, if the slides work. Are you able to get? Oh, thanks. Is it working, Zoe? Huh.
Just about, yeah. I've just
Don't know if we've lost Zoe.
Yeah, I it's frozen for me for Zoe.
Okay. So Zoe, can you hear us? Okay. So I guess just somebody just said then if you take your video off, it might help with bandwidth. I don't know if that's something that it might be possible. If you just put in the chat if you're having trouble, but I'll just talk through these while Zoe's struggling. So just to give you a bit of context of our trust, really. So we're a small acute trust, so Wrightington, Wigan and Leigh NHS Trust. We serve the people of Wigan and Leigh. So as a kind of region, we cover a couple of commissioning groups really, because Wrightington's actually in Lancashire, but the main hospitals are Wrightington Hospital, which is an orthopaedic specialist service. We've got specialist services there, community groups, and specialist orthopaedic area. We've got Leigh Hospital, which is a lot of outpatients, gynecology, obstetrics, and then we've also got a main hospital at Wigan, Wrightington, Wigan and Leigh. Sorry, Wigan Royal Infirmary. I'm just trying to get the presentation up now because I think we've lost Zoe. Sorry about the technical difficulties here, everybody. Not straightforward, is it, when you want it to be? So I guess just in terms of context, we already had a staff wellbeing service within the trust called Steps for Wellness. And this was established some years ago. It was around 2016. So the Steps for Wellness team consisted of Zoe as the wellbeing manager, 2 wellbeing practitioners who are actually joining us on the call today, and a health trainer. So they already formed the basis of our staff support, and we're working very much across the trust, working on strategic projects around staff engagement, working to promote wellbeing, doing health campaigns and promotions, Men's Health Week, working on things like menopause, covering a wide range of physical, mental health and wellbeing promotions. So when the things changed in the pandemic last year, there was already a really well established staff wellbeing service. Obviously, like many trusts, there was a big change in business as we kind of moved to support staff in a different way, and were presented with a number of challenges. And this is Zoe's story really, because I actually wasn't in post in the trust at this time, but it was really kind of about a shift to kind of working in different ways. So trying to I'll just try and get the slides back for you.
Sorry everyone, I'm back now.
I'll just click through. So do you want to
if I can share?
Do you want to go from this point, Zoe?
Great, yes, thank you. Sorry about that, everyone. Wonders of modern technology, eh? So before the pandemic started, we actually had luckily enough, within a Steps for Wellness wellbeing model. It was launched in 2016 as part of what we call our people promise. So that's kind of a number of pledges that we pledge to our staff, and one of those is a wellbeing pledge to help people stay happy and healthy in work. And our Steps for Wellness model follows kind of 4 key elements around mental health, healthy choice, and key, which you can see there on the slide. And it was quite a preventative promotion approach that we took to wellbeing. So it was very low level intervention. It was about educating people about what healthy choices were and how they could make behaviour change to keep more healthy and to improve their wellbeing. So this already existed. It was always kind of an add-on body's role in staff engagement team, and then from 2019, due to kind of role redesign, it actually became a specific part of roles within the team.
Possibly lost Zoe again there. Are you with us, Zoe? Okay. So can everyone else hear me okay?
Yeah, Alison,
Yeah.
I can hear you fine.
Yeah.
Yes,
So I
fine.
guess-
Alison, hi.
So just sort of carrying on from where Zoe left off there, just in terms of rationale then for us developing the service when in terms of the changes that the pandemic brought, just recognising obviously psychological impact on staff. So as you're all aware, in the different settings that you work in, really highly familiar and challenging circumstances, that there was a growing need for psychological support. Obviously, we know that mental health in the NHS workforce has been something that has been a cause for concern over many years, but it's really that the pandemic's thrown a spotlight on that, really, hasn't it, and just allowed us to look at that investment in a different way, and the kind of increased focus on burnout, absence being extremely high in the trusts. So the really concern for the trust was around the lasting psychological impact of this, and what that might mean in terms of attrition for the workforce, sustainability of services, and obviously then the critical support at the times of the surges in the waves of the pandemic itself. So the aims of the priorities were to think about supporting all levels of need for psychological support. So there was a recognition at that point that Steps of Wellness model wasn't able to meet the needs at more severe levels of distress in the workforce, and that led to thinking about expanding the mental health aspect of the Steps of Wellness, so the mental health foot, if you like, of the Steps of Wellness. So really kind of thinking about that longer term investment as well. So as Zoe just mentioned, the services prior to the pandemic, we did have an occupational health counselling service that was delivered by a third sector provider, and we didn't really have any a crossover with that service. It's very much related to occupational health referrals. The Steps of Wellness team, as Zoe said, fit within staff engagement and organisational development. And during the pandemic, there was some redeployment from other staff engagement teams to support the Steps of Wellness team and the mental health input. And Zoe will be able to tell you a little bit about some of the change in service to respond to the pandemic. So in April last year, the Trust developed a 12-month investment, a proof of concept model was put in place to look at mental health support for staff. So this was to aim to increase mental health provision. There was an individual offer in there to look at staff with more significant mental health needs, aims to target sickness absence, particularly looking at consultation training, more strategic working around supporting risk and mental health. And the additional posts within the 12-month proof of concept were my posts, clinical psychologist, an additional wellbeing practitioner who's got a psychotherapy background, 2 psychological support assistants, and then additional hours into Steps of Wellness team and additional hours into the counselling resource for WWL staff. So it's sort of 6 months on then by the time we all got in post, so sort of October, November time we started to work on this model. But the proof of concept really developed this stepped care model from where the Steps of Wellness team were working on the level 1, level 2 interventions, and the proof of concept model then was to provide that moderate and significant distress to kind of provide additional levels of support. So we're just going to go through these levels really and think about, just talk you through really where we are with each of those in this model. So level 1's around prevention, proactive mental health work. Zoe, are you available or are you?
I am back, I think. I'm on my phone now instead of my laptop, so I hope I've got a better connection on my phone. Sorry about that, everyone.
Do you want to jump back in?
Okay, so as Alison has explained, we opted for a stepped care model in terms of our psychological support. A lot of what our Steps for Wellness team already did was at level 1 mainly. So that included things like, as I was saying before, the promotion of good wellbeing in terms of communicating that out to people. So the things that we put in place specifically around the pandemic resource were our Steps for Wellness resource pack, which included lots of information to help with psychoeducation. So why might be people reacting as they are, just giving them a bit of an understanding really that it's normal during times of trauma to have those reactions and to behave in certain ways and to be experiencing certain things. And it also included in there some signposting on as well if they couldn't find the information in there or they felt like they needed further support. We also ran a number of staff briefings and that was for so specifically the one that springs to mind is we had quite a regular shielding forum from all of our staff who were not able to come into work for being clinically extremely vulnerable, and often from a shielding perspective, their own experiences and share that with other people and not feel like they were alone out there. And we also used our social media platforms as well to communicate out what we were doing, and signpost staff again to anything that we thought was relevant to their wellbeing needs. We also implemented some training. So we put in place some online training. This was to enable staff members to have a wellbeing conversation as part of the debrief. So it could be at the end of shift, for example, or it could be if there was a particularly distressing or traumatic event that happened during that time, checking with people before they left work to make sure that they were all right and they didn't need any extra support. So that was the idea of the 3-step process training. Also, it was taken up by some staff and some managers. We are still rolling that programme out to managers, particularly throughout the trust, because we recognise that there is a need to have that. I would say that the other challenge is that it's not always something that staff want to do at the end of shift. You know, they've worked for 12 hours. Sometimes they just want to go home and you know, be in their own environment. We're kind of saying to people, use the 3-step process in whatever way you want to. It doesn't have to be at the end of shift. The other thing that we have in place is training for psychological first aid. So that's within our team, but we also have some volunteers that we trained as well that sit in our SOS rooms who also undertook for psychological first aid training to be able to guide staff through a kind of diffusing conversation, again, give them some psychoeducation and talk to them about coping strategies throughout the pandemic and what they could do to help themselves. And we also had resilience training, which we've always delivered as part of Steps for Wellness. The other big thing which I think has really helped us to kind of build momentum and to help start to change behaviour and culture is our wellbeing leads. So these are, we had 6 wellbeing leads. We've now lost one through retirement, unfortunately. And so we're down to 5, but they do an amazing job. They're all senior level in the organisation, so they're all at a level of influence where they can make change depending on what staff are saying to them. So each week they go on a wellbeing walkabout to different areas across all of our sites and just listen to staff and what they're going through and what some of the hopes are and what some of the concerns are. And as I say, they're at that level of influence to be able to sort some of those things out for staff, but also to bang the drum for our wellbeing service as well and support our champions out there. I'm going to talk about champions in a minute. But yeah, that's been a real help having those wellbeing leads on board right from the beginning. And then as part of our comms, we also have apps as well, the usual Headspace. We also have what we call a Power to Respond app, which I'll talk to you about in a second. So just moving on to the next slide. We have Wellbeing Champions. So this was an initiative that was started before the pandemic as part of our Quality Champions initiative. So it was a member of my team, Michelle, who started that piece of work off. And, it's just grown and grown. And now we've got over 152 wellbeing champions across the trust. And, we're getting expressions of interest coming in every day for other people to become champions. So again, they're on the ground. They're able to support us with our conversations about wellbeing, as well as wellbeing that's done in their departments. You can see just some examples there on the slide around how they do wellbeing in their teams. So the tree, that's from our CPAP ward, and they've called it Tree Pap. And each leaf represents a patient that they've helped to get home and get better. So, that's really good, and it's something to be really proud of. So this is the type of work that our champions do as well for us, raising morale,
as well as wellbeing. So it's really important for us to have those wellbeing champions in place. And what I would say is that I think it's really impossible because of the passion that my team and Michelle in particular has had for this process and this project. And you know, Michelle just kind of bangs the drum all the time about wellbeing champions. So if you're thinking of putting these in place, if you haven't got them already, make sure that you do have those people who is really passionate and enthusiastic about it, because it does take a lot of effort to keep them on board and, you know, to keep them interested. We also have in-reach support. So this is members of the team visiting other teams and other departments, dropping in. They either do team drop-ins or they do individual wellbeing drop-ins. So that's just to kind of show that since the pandemic started, there was a bit of a lull in the summertime once we got past the peak. But then again, as there's been a lot more call for missions from our team. So it just shows that it's still going and that demand is still there with that low level intervention. Alison.
You sound is still in and out a bit, Zoe. So just let me know if you're dropping out. Yes, just move on to level 2. You still with us, Zoe?
Yeah, still here.
So yeah, so just move on to that level 2, that sort of mild distress. Do you want to talk through this bit? I can't see anybody, sorry.
Yeah, will do. So moving on to the next level, we were conscious that people might need additional support than just a low level intervention. So we actually contracted an employee system. We use Health Assured. I know there are other providers out there. But over the period from March 2020, we've had points that have gone big to count, and that's actually a benchmark 74%. Since they started, they have delivered 81 counselling sessions for our staff. So that's been valuable as well, because at the start of the pandemic, I know our occupational health counselling were not in a place necessarily to be able to offer those additional counselling calls. So it was really helpful to get this employee assistance programme up and running. At this level, we also have our steps of support room, and this is a safe space on all of our sites for staff to visit if they want to have a cry, if they want to have a shout, if they just want to chat to someone, if they just want to sit and have a minute of peace. We have staff rooms. We have over 40 SOS responders at the start of the pandemic, and psychological support practitioners as well, who were trained in diffusing techniques to have those wellbeing conversations with staff in those SOS rooms. And as I say, that was about listening to them, listening to whatever it was that they brought to the room, and taking them through a guided structure to kind of educate them around why they might be feeling that way, but also ending on a real positive about how are they coping at the moment and what are they going to do positively for themselves to help themselves during this time. The graph on the right hand side shows that over time the number of visits to those rooms has decreased. So it's kind of been converse to what we've seen in activity in reach sessions. We do still staff the rooms occasionally, so people will visit, but we're now thinking about repurposing those rooms as well, because it's quite clear to us that the need for that room has changed, and the need for psychological support for our staff has changed. So we're just kind of monitoring that on an ongoing basis, whether it's needed any longer.
Thanks, Zoe. So also at level 2, what we've set up this year is the use of Schwartz rounds and reflective groups. So I know Schwartz rounds are run across GM, and this is something that we've had monthly since January. There has been some challenges in getting the Schwartz rounds running regularly and consistently, but I think we've had 4 rounds now that have been really, really well attended and really good feedback from staff that have attended them. We started sort of with specific topics for each round, and sometimes we have struggled to get storytellers for the rounds, so we just need to think a lot more flexibly, I think, going forward in the next 6 months about how we get storytellers, how we offer the rounds, the times of day we're offering the rounds, for example. So they're on a monthly basis. We've also lost a couple of facilitators from maternity leave or leaving the trust, so we're just about to train another cohort of facilitators to support the ongoing running of the rounds. And there's also within that model some flexible options around things like team time, which is a reflective approach for a particular team to talk through stories and experiences that they've had and sharing that emotional processing just within their team. So the Schwartz round model just does offer an opportunity to come together and talk about a particular work related experience that a colleague might have had, that you can then recognise as an audience member whether you resonate with that, the emotions that you experience when you hear that, and it just helps to build that culture of openly sharing emotions and recognising that there is a person within the professional, just kind of help us separate that and have a safe space to share those experiences. So again, it adds to that culture of wellbeing, a culture of emotional sharing, that it's okay not to be okay. It's okay to experience difficulties and challenges on an emotional and psychological level when we have a duty of care and we're professionals who have a specific role to share, to do. Along the same lines, we've got leadership support circles, which is follows the nationally recommended format to engage leaders in thinking about compassionate leadership and, again, a reflective safe space. We've run a couple of successful rounds. They've been run by the learning development team and with support from staff engagement as a whole, and we'd like to build on that, and the specific groups of critical care leads, for example, that want to use that sort of format going forward. I've offered a couple of bespoke reflective practice groups where we've had specific teams coming forward that would like some space to talk about what's happened, for example, breast care nurses or sleep clinics, so perhaps groups of staff that have had huge change of process and difficulty managing conflicting demands in the workplace over the last 12 months, experiencing their own difficulties in keeping going and, you know, still kind of committing to that role and just want some space. And that's been great to work with Steps to Wellness team and the models that they've already got going on, so we can share the challenges that have come up for a particular team and think about the best approach to take. The mindfulness daily living groups, we've got Jo Watson on the call today, who's our mindfulness practitioner. So she runs a really, really successful and really well attended mindfulness daily living group that has a bit of a combination of resilience work, mindfulness as an intervention, some stress management approaches, and it's a 6-week group. We've just recently started that again in person, and there's a waiting list already for that. We've got real interest for 2 more cohorts in June and 2 more cohorts in September. Again, just kind of looking at that refocused intervention for people to have a toolbox of approaches to use. The screening programme for critical care staff is one we've just started recently. So myself and the psychological support assistants have developed a mental health screening programme, questionnaire based screen for critical care staff that's gone out to the ICU staff and the CPAP ward staff to screen for low mood and anxiety, a measure around activities of daily living, and also using the ProQual questionnaire, which looks at secondary trauma scale, burnout and compassion satisfaction. So the outcomes of those screening measures also link in with the GM Resilience Hub screening tools. So the idea being that we can signpost staff who need some support quickly to the GM Resilience Hub for that one-to-one. We offer the staff a follow-up discussion about their results to think about how best to support them, what might help them going forward. We have had a number of staff express suicidal ideation in those questionnaires. Obviously, we follow them up urgently with a questionnaire, a phone call to see if they're safe, offer them some crisis support, signpost them to local crisis services if needed. So the general aim of that screening programme is just to get some support to staff at the right time, at the level they need. Including things like the burnout and compassion satisfaction measures was really to help us plan service going forward, because we are going to offer some therapeutic group work to these staff members now. So we've got an act-based values based group that we are going to offer the critical care staff to work on that side of things, kind of moral injury issues, the challenges to compassion and care when we've